two, one, two, three.
Hello and welcome to Ithaca DSA Presents. I'm Theresa Alt. I'm here with Richard Gottlieb, a retired member of the New York State Assembly and author of the New York Health Act. So, what is the New York Health Act?
It is a proposal. It's something that is sometimes called improved Medicare for all or single payer. This would be at the state level. It would provide health coverage for every New York resident, regardless of age or income or employment status or immigration status. Every New Yorker would be covered. The coverage is more comprehensive in terms of benefits than any health plan that I've ever seen or heard of. It would certainly cover, outpatient care, primary care, hospitalization, dental, vision, hearing, reproductive care, et cetera, et cetera. One major thing that it covers that health insurance, including Medicare, generally does not cover is long-term care, whether home care or nursing home care. And, that is something that, about half of all older New Yorkers at some point in their life will need home care or nursing home care. And the cost can really wipe out a family's life savings. It has no premium, no deductible, no copay, no other out-of-pocket charges. No restricted provider network, which almost every insurance plan has. And here's how it's paid for. First of all, we get billions of dollars in savings as a result of the New York Health Act. People always ask, oh, what's it going to cost? It actually saves an enormous amount of money. Taking insurance companies out of the picture eliminates more than 20 billion that we now spend every year on insurance company bureaucracy, marketing, and profit. Taking insurance companies out of the picture dramatically slashes what we have to pay to doctors and hospitals and other providers for administrative costs to fight with insurance companies. And because the New York Health Plan would be bargaining on behalf of 20 million covered lives, we would have the capacity to bring down drug prices dramatically. Now, on the other hand, there would certainly be increased spending, picking up all those out-of-pocket costs, covering the uninsured, covering long-term care, et cetera. But any number of very professional studies have documented that the net savings from the New York Health Act would save New York State almost $20 billion a year net. And it is also funded by a progressively graduated tax on income, meaning that income in lower brackets is taxed at a lower rate than upper income. And between the savings and the fact that the taxation would be progressively graduated based on ability to pay, about 95% of New Yorkers would be spending less on health care and health coverage than they are spending today. So that's the basic outlines of the plan.
Okay, I can see how there would be savings by simplifying the bureaucracies. I recently got a bill for a copay or a deductible, $7.50. I paid it thinking I'll bet it cost more to bill me and then to deposit the check
Yeah.
than I paid. Now I'm on traditional Medicare. So,
hmm Well, and and it's not just the billing of copays. The fact that insurance companies, hire, with our money, hire people to look at our ailments that they know really nothing about and say, sorry, we're not going to pay for that. Your doctor went to medical school and believes this is the treatment you need, but we here at United Healthcare, we know better. We're not going to pay for it. Plus, there's the marketing, all those advertisements. We pay for that, and insurance company profit we pay for. And a hospital in the United States spends about twice what a hospital in Canada has to spend on administrative costs because they spend so much time fighting with insurance companies. In Canada, they don't have to do that. And drug companies can charge, outrageous prices in America because nobody really has the bargaining clout to bargain with them. Medicare is beginning to, but New York Health would be bargaining on behalf of many times more New Yorkers than are covered by Medicare. And so it would dramatically bring down drug prices in New York as well.
I suppose another thing is that for the hospitals, well, and the doctors, that they reliably can get their pay, we hope, from New York State, which won't suddenly one day find its bank account empty. Whereas if they're relying on lots of people, especially uninsured people, they may not have the money for the health care that they need.
Yeah, well, many of our hospitals are constantly, on the edge financially, and that's partly because Medicare and Medicaid notoriously do not pay the full cost of care. And, some people hear that fact and say, well, what makes you think the New York Health Act is going to be any better? And what will keep the quality of care and everything else top notch under the New York Health Act is that it is not just a program for poor people, because people in government can kick around programs for poor people. It's not only a program for the minority of the population that's over 65. The governor and every one of the governor's staff, every member of his family, all of his friends, every member of the New York legislature, all of their family and friends will all be covered by the New York Health Act. They will have a powerful vested interest in making sure that New York Health treats them and their doctor and their neighborhood hospital as well as can be done. And 20 million of us will get to be part of the same plan. And that factor of all in the same boat not only generates a lot of the savings, it is also, I think, the magic sauce that guarantees the quality of the program.
Right. The same for everybody.
Exactly. And the people with wealth and power who will make sure that they and their families are taken care of will at the same time be making sure that the rest of us are taken care of.
Through graduated taxes.
Yeah, it'll be paid for through a progressively graduated tax, not only on earning from labor, the income that is now subject to, for example, the Medicare tax, but the tax would also apply to taxable dividends and capital gains and the like, which frankly in our society is where the big money is. And it's because of that broad-based progressive tax that almost every New Yorker, combined with the savings, will be spending less on health care and coverage than they are today.
Right. Less, you might say individually, but there is also another, you might say, savings for especially those of us out in rural and small town New York, and that has to do with how Medicare is financed. Medicaid is financed. I'm sorry, Medicaid is financed.
Yeah, New York State, from the start of Medicaid, has been, I think we may be the only state in the union, certainly it's a small minority, that require our counties to chip in for part of the cost of Medicaid. You know, Medicaid, the most of that money comes from Washington. The state used to require counties to chip in half of what the state had to contribute. Now, in recent years, that amount has been whittled down considerably, uh, but it's still, you know, a significant item on the books of our county governments and comes out of property tax and sales tax. But under the New York Health Act, the progressively graduated New York State, New York health tax would be picking up the county share of Medicaid. So that would be one burden off the county local property tax and sales tax.
Which means a lot to us out here in Tompkins County, where our property taxes are seriously reduced by a very large university that is tax exempt and
Yeah,
yet owns a lot of the land here.
yeah.
Another matter is why we are talking about this just now.
Mhm. Some of us, of course, have been talking about it for quite a number of years now, and the bill has actually passed in the state assembly a few times, but it's still got a lot to overcome. There's a lot more interest in it now because I would say for two reasons. One, a little bit of politics. I think a lot of people woke up to the fact, and I think DSA knew it all along, but a lot of people woke up to the fact in this election that the Democratic Party's message was not going very far on the kitchen table issues that concern working people and their families. And, you know, it's hard to think of an area of our economy that is more rigged against working people than the way we pay for healthcare. And, you know, it's almost 20% of our economy. And if we can deliver a real dollars and cents and healthcare benefit to working New Yorkers, I think that would be an enormous political change, number one. Number two, Lord knows what Trump and the Republicans in Washington are going to do to Medicare and Medicaid, which are crucial to funding healthcare in New York. But whatever they do, it's a pretty safe bet. New York is going to lose a lot of federal healthcare money. And we're either then going to have to say, oh, that's too bad. People will die. Well, at least we have space in our cemeteries. Or we are going to do something about it at the state level and struggle to fill in the gaps that Washington will be creating. And if we're going to try to fill in the gaps that Washington creates, then the savings and the fair fundraising that are at the heart of the New York Health Act will be vastly more important even than they are today. And, you know, there's an important message to people who say, well, I'm not 65 yet, so I don't have to worry about Medicare, or I'm not poor, so if they cut Medicaid, you know, how does that affect me? Well, here's how it affects you. If you go into a hospital, there are no Medicaid or Medicare doctors. There are no Medicaid or Medicare nurses or Medicaid or Medicare beds. And if you pull millions of dollars out of a hospital by cutting Medicare or Medicaid, then that hospital is going to respond by cutting back. And that means that the wealthiest person in town who arrives with a heart attack is going to get care that is stretched thinner and is going to be more likely to die. And so whatever Donald Trump does to Medicare and Medicaid is going to affect the health care of every New Yorker. And the New York Health Act, I believe, is the only available mechanism to New York to fight back.
For those who say, no, skip the state, we need a national plan.
Well, you
Well,
know, if I had a magic wand, we'd have a national plan. If I had a magic wand, we would have had a national plan like the New York Health Act enacted nationally more than 30 years ago, or longer ago than that.
yes.
If Harry Truman had had a magic wand, it would have been done back in the 1940s. But nobody in Washington has a magic wand. And the history of this country is that good progressive legislation begins at the state level. The federal government did not invent universal free public education. New York and a handful of other states abolished slavery decades before the Civil War. Labor laws, anti-discrimination laws, you could go on and on with things that began in America at the state level, usually in New York, by the way, and eventually went national. And, you know, except for a couple of brief moments in American history, the Albany legislature, for all of its faults, Albany has been a lot more progressive and a lot more friendly to consumers and workers and patients than Washington has been. And so a universal health plan is not only going to come quicker at the state level, it is undoubtedly going to be better than if it started at the federal level.
Well, and there were also back when the discussions were national more than state, say the 1990s, it was always pointed out that Canada had a single payer system and it
Yes.
started in one province and
That-
not the biggest, most urban one, but Saskatchewan.
Yep. Yeah. You know, people refer to the Canadian health plan. It is in fact a collection of what is it, 11 or 12 provincial health plans. And first Saskatchewan did it, and then a couple of others. And then finally their national government said, well, any province that enacts a health plan essentially like Saskatchewan, they spelled out a half a dozen criteria in the Canada Health Act. They said any province that sets up a plan like this, we, the Canadian government, will pay, I think it's 2/3 of the price. It may be more than that now. But that's how it happened. By the way, the child health insurance plan in America, which is free or very low cost health care for children up to the age of 19 whose household is too wealthy for Medicaid. That plan began in Minnesota at the end of the 1980s, I think. In the early 90s, New York shamelessly copied Minnesota, and I remember it well because it was, hello, my bill. And, we started it very small, we expanded it, and within about 6 or 7 years, the federal government said, this is a good idea. Any state that does what New York and Minnesota have done, we will pay 2/3 of the bill. And within a couple of years, every state in the country had something like New York's Child Health Plus. But
Wow,
those
that's impressive.
state level. And by the way,
So,
when I retired from the legislature and people asked me what piece of legislation was I most proud of, it was Child Health Plus. No doubt about it.
so in fact, working to get the New York Health Act passed is not happening only on this radio program and this television program. It is also going on there. People around the state are making phone calls right now, this week,
Yeah.
to their elected representatives in Albany. Well, they are probably home from Albany right now, but wherever they are.
Yeah. Yeah. There are advocacy groups all over the state that have been lobbying for the New York Health Act for years now. There are several major unions whose leaders will tell you at the drop of a hat that every time they're at the bargaining table, they have to sacrifice wages and benefits in order to protect the union health plan. And they would love to get the union health plan off the bargaining table. And the New York Health Act would do that so they could get back to focusing full time on wages and retirement and other things. So there is a lot of advocacy for the New York Health Act. DSA chapters around the state are certainly in the fight as well.
Yes, I know. We put out messages to our members here
Mhm.
in Ithaca.
As I said earlier, I think in this past election, I certainly hope that an awful lot of Democrats realized that we need to do a much better job of offering really tangible, some people call kitchen table, dollars and cents benefits to working people and their families. Nothing would do more to protect and improve the family finances of virtually every New Yorker. Nothing would do more than enacting the New York Health Act.
Well, thank you, Dick Gottfried. This has been informative about the New York Health Act. I have a few minutes now, so I can tell you how this interview came about. First, a few more words about Richard Gottfried. He grew up in Queens and attended Cornell as an undergraduate. He returned to the Upper West Side of New York City and studied law at Columbia. As a law student in 1970, he won a seat in the New York State Assembly. He stayed there for 52 years, retiring at the end of 2022. In about 1992, he wrote the first version of the New York Health Act. It covered visits to doctors, hospital stays, mental health, dental health, visual and hearing. Only in a later version was long-term care, both at home and in institutions, added. Now retired, he is active in the campaign for New York Health. I recently joined their online meeting. This is an example of how my life as an activist brings me into contact with many of the people interviewed on The Inquiring Socialist. We both stayed on after the end of the scheduled meeting, and he gladly accepted my offer to interview him. These are times that have some people very scared, shocked. We really do not know what things that we count on may be taken away by Project 2025. But there is also hope. Hope that New York State can once again get ahead of the rest of the country in giving its people the things that they really need. For instance, health care. For everyone, not just for the rich. These are times that have some people very scared, shocked. We really do not know what things that we count on may be taken away by Project 2025. But there is also hope. Hope that New York State can once again get ahead of the rest of the country in giving its people the things that they really need. For instance, health care. For everyone, not just for the rich. I can add a little about how Ithaca first learned about the New York Health Act. The year was 1992. National DSA, a much smaller organization in those days, had taken up advocating for single payer as a priority. In our local electoral work, we had helped to get Marty Luster elected as the area's first Democratic assemblyman. There was no community radio at that time, and Ithaca DSA did not yet have a cable television show. Marty Luster told us about the bill, the New York Health Act. We published an article in our newsletter, which was mailed monthly to over 100 people. We scooped the story. No other local publication told about it. The next year, Bill Clinton became president, National health insurance was on his agenda. Hillary Clinton was in charge of the planning and would not allow a single-payer plan to be discussed. However, people around the country were working for single-payer. In Ithaca, there were two groups, Ithaca DSA and the League of Women Voters. I recall working on a trifold leaflet and handing it out to all the cars stopped at the traffic light after leaving the farmer's market. I know we were handing it out in many other places as well. Our congressman back then was Maurice Hinchey. He was a steadfast proponent of single-payer. I recall a public meeting where right-wingers declared that it was a socialist plan. Hinchey replied that in the early 19th century, the road from the Hudson Valley was a turnpike where you had to pay to use it. Then the U.S. decided to socialize the roads, and we are all pleased with the result. Our DSA campaign renamed itself the Ithaca Healthcare Action Network and thus added a couple of members. It also became de facto the Ithaca Healthcare Acting Network when we did a little guerrilla theater at the Ithaca Festival. We put on a fantasy play in which two cars collide on the Rainbow Bridge. The Canadian is thrown into the United States and is suddenly confronted with the need to pay for his health care. The U.S. citizen is thrown into Canada, where he learns that he doesn't have to pay. And of course, those of us who didn't have acting skills were running around passing out our leaflets. In subsequent years, activists from the more explicitly socialist Ithaca Healthcare Action Network and from the League of Women Voters came together to advocate for the New York Health Act in the newer organization, Finger Lakes for New York Health. You can still see some of their yard signs around. This has been Ithaca DSA Presents. I'm Theresa Alt. Thanks for watching.
1, 2, 1, 2, 3.